Now concerning the immunoassays, here it is the basic ELISA, where a complex of PF4 and heparin or polyvinyl sulfonate is used as a capture antigen. The ligand can be heparin or polyvinyl sulfonate, and PF4 is used. It is very important to have a very well defined antigen with the right concentration between PF4 and heparin, which is of 27 units of heparin per milligram of PF4. And as we quote at 20 micrograms per ml of PF4, usually for this kind of assays, the amount of heparin used is of 0.5 units. Another point is the quality of PF4. We need to use a PF4 which is in the tetrameric form. It is very important because if PF4 is in the monomer or dimer presentation, then the reactive complexes are not formed in the same way. And having a good control for the antigen presentation is mandatory for having a reproducible and reliable assay. So this antigen is coated on the microELISA plate, and then the dilute assay plasma is incubated in the coat microwell. If antibodies are present, they bind to PF4 heparin or PF4 polyvinyl sulfonate complexes. Then following a washing step for removing unbound material, a conjugate is added, which can be specific for one of the isotypes and mainly IgG for the most specific and clinically relevant assays. Or if we prefer, having a global immunoreactivity, an anti-IgG-AM conjugate or anti-AGA or M when necessary. And this second antibody is labeled with an enzymatic activity which usually is peroxidase. Then following a washing step for removal of the unbound material, the amount of enzymatic activity is revealed by the use of a specific substrate, which is usually now TMB, tetramethylbenzidine, in presence of hydrogen peroxide, and then a yellow color develops, a blue color develops, which turns yellow when the reaction is stopped with sulfuric acid. This assay shows the membrane immunofiltration assay, the PIFA assay, which uses latex particles coated with PF4 and heparin, and these latex particles are incubated with the assayed sample. If no antibody heparin dependent is present, nothing occurs, and then microparticles can go through the membrane, and there is no latex particle aggregate retained on the membrane, and no color then is observed. If antibodies are present, then they bind to PF4 and heparin on the latex particles, and they form aggregates which are unable to pass through the membrane, and then they form an aggregate, a latex particles aggregate, which produces a blue color. And then the response is positive. Concerning the PJ assay from BioMed, so this assay uses a gel and latex particles, and these latex particles are incubated with the assayed serum. If antibodies are not present, nothing binds to latex particles, and when there is a centrifugation step for this device, the latex particles, they can go to the bottom of the tube, and there is no color at the top. If antibodies are present, if the test sample is positive, then latex particles aggregate with antibodies, and they are unable to penetrate to the gel, and there is no latex particles obtained at the tube bottom. No? Practically, for this assay, the assay sample is mixed with latex particles on the top of the tube, and then the device is centrifuged, Okay, and then according to presence of antibodies or not, the latex particles can go to the bottom or remain at the top of the gel, and then we can conclude by a positive or a negative answer. And finally, this is a new assay that we developed a few years ago, and this assay uses biologically available heparin bound on a micro-ELISA plate. Okay? So heparin is exposed on the micro-ELISA plate as it is expected to be exposed on blood cells binding heparin, mainly platelets and endothelial cells. And I forgot to mention when I spoke on mechanism that in pathology, when there is a higher incidence of activated platelets in blood circulation, these platelets have a much higher propensity to bind heparin. And this heparin present on cells, or here on the micro-ELISA plate, through a specific ligand, then is mixed with a platelet lysate, which is non-purified PF4, so all what is releasable from disrupt platelets, and the assayed plasma or serum. And if antibodies are present, then there is a dynamic complex formation between biologically available heparin, PF4, or in some few cases IL-8 or NAP2, and antibody. And in this case, you know, this dynamic model favors the antibody affinity, because higher is the affinity and faster is the formation and the binding on these complexes onto immobilized heparin. And heparin can be immobilized on the ELISA plate using two different systems. The one which is used for the commercial assay is protamine sulfate, which is in, and heparin is in a very large excess. So protamine sulfate is only used for anchoring heparin on the plate. But we can also use streptavidin and biotinylate heparin, and we obtain the same result. But you know, there will be some difference in the assay performance, especially due to the fact that protamine sulfate can be active in some patients, and I will come back to this point later. So following the binding, the generation of the immune complexes, there is a washing step, and as for the other ELISAs, we use a conjugate, which can be specific for IgG, now it is the preferred assay, or for the other isotypes, IgA or IgM, or for the pool of antibodies, in order to have a global test and a better evaluation of the risk assessment to evolve to hit and not to miss any patient who has been developing antibodies. But for the clinical relationship, I would like to stress on the fact that it is preferred to measure IgGs. We use also TMB and with hydrogen peroxide, which yields a blue color which turns yellow when the reaction is stopped with sulfuric acid, and the color generated is measured at 450 nanometers. So there is another presentation of this assay with the coat plate, you know, the coating of the plate. The unbound material is removed. The test specimen is incubated with the platelet lysate, which brings PF4, which also some IL-8. And then the conjugate is introduced, and after the washing step, the substrate. And when the color develops, there is this measurement at 450 nanometers, and here are the different steps of the assay. And we can use protamine sulfate or streptavidin with biotinylate and fractionated heparin.